Guys, for our last lesson on mental health conditions, we're going to talk about suicidal behavior. So someone with suicidal behavior is someone with constant feelings of hopelessness, guilt, and worthlessness that are so overwhelming that they don't want to live anymore and they attempt to end their life. Now, there can be a lot of stigma and controversy around suicide, so we're going to focus objectively on how we care for someone who may be having thoughts of harming or killing themselves. So let's talk about clients who are at high risk for suicidal behavior. Anyone with a family history or personal history of suicide or suicide attempts is at a higher risk, statistically speaking, for committing suicide. Okay. Those with mental health disorders and terminal illness are also at risk. It's hard to imagine what it might feel like to be out of control of your own, body or mind. So that's where that higher risk comes in. Physical disabilities, especially new or sudden changes like amputation, can put somebody at higher risk. And then again, statistically speaking, adolescents and the elderly are at higher risk. Now, there are some signs that we can watch for in those around us or in our patients that might be signs of an impending suicide attempt. If someone starts to give away prized possessions, especially sentimental things or something that they've collected for years, that might mean they're trying to give them a good home because they won't be around to take care of them anymore. Also, changing a will or a life insurance policy, losing interest in their usual life, or even asking about methods like how to buy a gun or how much Tylenol can I take before I would die. They may even write notes to loved ones weeks or months before the actual action. And the last one is the one I really want you to get. If you have a client who is severely depressed and suddenly they're happy, like almost overnight, if you see this sudden massive improvement in mood, it might be because they have finally resolved or decided to go through with it. Or maybe they came up with a plan. It's like a weight has been relieved off their shoulders. They're almost relieved because they figured out how to end it all. And the problem is this can be mistaken as someone getting better, but this sudden improvement needs to be evaluated because it is almost always a bad sign. So you have heard us talk about self-harm assessments throughout this whole module, but nowhere is it more important than in a client who is at risk for suicidal behavior. Now, the best tip that we have for you is be very direct and calm in your questioning. Don't skirt around it or try to be politically correct. Ask them directly. Are you having thoughts of hurting yourself or someone else? If they say yes, we ask directly again, do you have a plan for how to do that? If they have a plan, they are more likely to follow through. Now, if they say yes, even if they don't have a plan, you need to put them on suicide precautions. So this is going to look slightly different for each facility. So you do need to follow your facility's policies, but it usually involves some sort of one-to-one observation. It involves removing dangerous objects from their room, like phone cords. We might even remove monitor cables if it's possible. We'll give them plastic utensils. We also keep someone at arm's length at all times. Guys, this means they don't even go to the bathroom by themselves, okay? We'll also do a suicide contract where we literally have them sign a written contract saying that they won't harm themselves while they're in our care. Sometimes just the act of signing this makes them feel, like they would let us down if they did hurt themselves. So a lot of times that helps psychologically to keep them from doing it. And then if some facilities it will require that we screen visitors, or some places don't even allow visitors at all. Now, a couple of interventions that honestly probably make a lot of sense to you now. Establish trust and rapport. We have to let them know that we are a safe space for them. We want to promote self-care, focus on their strengths, involve their support system if possible, and encourage therapy for long-term success. But more than anything, we have to validate their feelings, okay? I had a patient once. It was a really sad case. She was beaten by her boyfriend. She blamed herself because she had cheated on him, and then she tried to kill herself. So as I was caring for her, she was extremely tearful and, of course, frustrated because we had to restrict visitors. We had to take away her phone because the boyfriend was texting her awful things. And as we were talking, she told me she felt like she'd never get out of the hospital because everyone just wanted her to be happy and she couldn't do that. And I sat down with her and I told her that no one expected her to be suddenly happy, but we did need to know that she was going to be safe. Okay. So it wasn't about being happy. So I told her, listen, you don't have to be happy. You're allowed to be sad. You're allowed to be hurt. You're allowed to be frustrated, but you have to handle that in a way that's healthy. So, we talked about journaling and we talked about, who can you call when you're having a sad moment and you need someone to talk to. By the morning, she had started journaling. She was calm. She was ready to talk to the psychologist. So just remember that we validate that it's okay to feel sad, but we have to handle our sadness in a healthy way. So, as you may already have predicted, priority nursing concepts for a patient with suicidal behavior are safety, mood, affect, and coping. So make sure you look for those things that might indicate there's a problem. So let's recap quickly. Suicidal behavior happens when someone has so much guilt, pain, sadness, fear, etc., that they just want to end it all by taking their own life. Clients with a history of suicidal behavior, terminal illness, or those telltale behaviors like giving things away may be at higher risk. We always want to do a self-harm assessment and be very, very direct in our questions. Ask if they have a plan. If they do have thoughts of hurting themselves, we institute suicide precautions, following your facility's specific protocol, usually one-to-one monitoring and other safety precautions. And then we always want to ensure healthy coping, express feelings, involve their support system, and utilize some form of long-term therapy. So caring for a client with suicidal behavior can be overwhelming emotionally, but if you follow these guidelines and remember to keep safety first, you can help get them through that difficult time. So go out and be that nurse for these patients, okay? And as always, guys, we love you. Happy nursing.